Independent consultant Martin Bell is an expert in digital health and healthcare IT. Well, I talked to him for this MedLearn event about the NHS, about Brexit, social care, and of course, his specialist subject, digital health. And we're going to be talking generally about the NHS, but of course about digital healthcare, because that's an area where Martin is an expert. So first of all, Martin, can you just tell me a little bit about your background?
Yes, sure. So my name is Martin Bell. I now run the Martin Bell Partnership consultancy, specialising, as you said, in healthcare IT, working with a range of organisations, but particularly corporate healthcare IT vendors, investment houses, and I get to work with a lot of digital health startups. I'm the digital ambassador for this event, really excited to be taking part in it. And I was a former CIO in the NHS and also a senior executive with the UK's leading clinical systems provider.
So first of all, Martin, can you talk to me about the challenges and opportunities that are facing the NHS at the moment?
So some of the challenges that are facing the NHS are obviously, first of all, the increase in long-term conditions, the increase in diabetes, COPD, increases in adult and childhood obesity, people living longer. The second one is financial. Although there's been a recent settlement that's given 3% or so extra on the budgets for the NHS, not just in England, but in Scotland, Wales and Northern Ireland as well. Actually, most of the independent think tanks think that the NHS needs probably 4 to 5% to get ahead of the game rather than just covering its costs. The third area is, of course, how does the NHS embrace digital, not for the sake of digital, but actually to improve patient care and clinical outcomes.
Also, another massive thing facing the NHS, isn't there? There's something not too far away, beginning with B, Brexit.
Do you mean Brexit, by any chance? So however you voted and whatever your views on Brexit, it's very difficult to forecast what may happen when it occurs. We don't even yet know what the format of it occurring might be. However, for healthcare, there are some particular challenges. There is great cooperation across Europe in terms of working together on medicines, clinical standards, on drug regulation, on medical device regulation. There is free movement of supplies, medical supplies, clinical supplies that make our hospitals and our community facilities work. And of course there's also a significant number of people working in the NHS who come from overseas. And their work is hugely valued, and because of the disinvestment in the UK in training clinical staff over the past 10 years, fewer doctors, fewer nurses, fewer midwives, etc., actually their services are really required.
Can you predict the future when it comes to Brexit for the NHS?
I don't think we can predict, because I don't think we yet know what the deal is. I think that the NHS, along with all other public bodies, is making necessary contingency plans. How effective those contingency plans will only be seen if they are needed. But it's certainly a concerning time.
Okay. Well, we're going to move on to a completely different subject, and that's the social care green paper that is going to be coming out very soon. Can you tell us a little bit about that?
So the social care green paper, by the time this airs, might well have come out. And we need to see what's going to be in it. But we're probably going to be looking at some kind of insurance scheme, some form of taxation, however you want to phrase it, to fund future social care, care for the elderly, etc. Councils have had budgets generally cut. They've had central government grants cut. Yes, they've had a little preset, a little extra that they can add, which they can invoke, but they've had significant budget cuts. And the local government authority, the combined council body, suggests that there's probably a £3.5 billion funding gap for social care. And again, as per the earlier NHS comments, probably just to keep pace rather than necessarily get ahead. And health and care are two sides of the same coin. If we fix and improve health, we can't do that. That is an impossible equation to meet if we don't also fix care at the same time, in my view.
And is it social care, has it historically been an area that has been underfunded, do you think? Or?
Yes, I think it's historically been one of the areas of the health and care world that's been underfunded. I think there are other areas like mental health, children's mental health services, community services.
So what I would like to find out from you, Martin, is you are an expert in digital healthcare and healthcare IT. So tell us what the situation is at the moment with regard to that industry.
So despite what people think, there is huge amounts of digital and healthcare used across the NHS. So if we look at spending in the UK on healthcare and in the NHS, broadly, depending on what central initiative money is made available in any given year, you're looking at something in the region of £4.5 to £5 billion per annum spent on healthcare IT. That breaks down into about 4 billion of that being spent in England, and you've probably got a little in excess of 2 billion of that being spent mainly in the acute hospital sector. Now, just to put a little bit of context around that, that probably represents about 2% of the annual budget of the NHS. Probably up from about 10 years ago when average spending was about 1.4%, but nowhere near the levels of 3 to 5% that are often spoken about as being required to rapidly move forward with transformational change. The 2% that is spent is not necessarily evenly distributed. So again, there might be more spent in some acutes, there will be less spent maybe in some of the community or mental health organisations, and actually care itself, whether domiciliary care, care homes, social care, has quite a significant way even further to travel in terms of digitisation.
And where are we at with in regard to the digital health market? What are the latest technologies? And do you feel that they're being used effectively within the NHS?
So there's always lots of new technologies, isn't there? The latest fad, the latest sexy tech. Come back to those in a minute. You've got within healthcare, certainly within the NHS, a huge amount of IT. The people working around healthcare informatics, the people, whether clinicians or IT folk or others involved, transformational change people, over a long period of time, but certainly over the past 10 years, there's been a rapid increase in the uptake of the usage of technology, whether that's electronic patient records, whether that's electronic prescribing, whether that's systems used to support pathology, radiology, imaging, pharmacy, the kind of basics of running healthcare. So whether you're in a hospital or a GP practice or a community trust, you need a core system, and if you're in a hospital, particularly complex environment, you need more than that one system because there's so many different specialties to deal with. Where there is a struggle is that obviously funding comes down from time to time, but not always the right type of money. So it might be capital, has to be spent now, not revenue for ongoing cost. There's been some significant announcements recently, in excess of 600 million. That's been announced by the new Secretary of State for Health and Social Care, Matt Hancock, which is very, very welcomed. But again, although it sounds like a big headline figure, there's only about 100 million or so of that is guaranteed in this financial year, and then another slice in the next financial year. And then beyond that, again, two things. Number one, will this government survive past Brexit? And indeed, will we then have a new government and new policies and new processes? And for the further monies out, the money in the later years, actually there is the issue of there's another comprehensive spending review across government, which again could alter that. So the money that's been announced long term isn't guaranteed, although it's welcomed, and the complexities around finance. The other issue is that there's a lot of what one might call traditional or even legacy technologies. There's a big campaign at the moment in the NHS called Axe the Fax. There's still a lot of facsimiles, fax machines, pagers, older technologies that are used. They need to be driven out and replaced with more modern technology. There is then some innovation around some of the really sexy new tech, but also some questions about the relevance or the evidence supporting whether it makes a difference to clinical care.
So what can we look forward to over the next decade?
Putting me on the spot now for the next 10 years. You can come back in 10 years and see whether it happened. Over the next 10 years, I think that we will see an increase in digitally enabled services, an increase in the usage of things like doctor on demand, nurse on demand, video consulting. We will see increases, as we have done already, in systems becoming interconnected, data being shared. We will see an increase in open standards, people working together, partnerships, and we will see increases in patients becoming involved digitally in their care. What we won't necessarily see is that happening evenly at any one moment in time, and because of the way that NHS finances flow, or sometimes don't flow, then we might not see that happen, certainly at the pace that people would like. One final critical point, Anna. In all of this health tech is great, tech can be marvellous. What's absolutely needed alongside all of the health tech is the transformational change piece, the support for people working in healthcare to change their practice, to change how they deliver services, and to change how they engage with patients.
So thank you ever so much for talking to me, Martin, and I wish you all the best of luck with the Martin Bell partnership, and thank you for talking to me for the MedLearn events.
Thank you very much, Anne.